Good morning. It's Monday, July 17, and I'm happy to see everybody who joins us in Ukraine Media Center, Ukrinform. My name is Koля Atamanova, and today we have invited you for a very important and interesting event. It's been 10 years of the war and day 510 of the full-scale invasion of our homeland by Russian aggressor, and now we will be talking about the launch of the nationwide campaign for the kids' vaccination against measles. The war influenced all the spheres of our life, and medical sector is no exception. So we will talk about the launch of the vaccination campaign, where it can be bought, in what amounts. We will be talking about our partners who help us in this process. So I want to introduce our speakers today. It's Ihor Kuzin, Deputy Minister of Health of Ukraine, Chief State Sanitary Doctor; Muhammad Tariq Iqbal, Health Immunization Specialist at UNICEF. Also joining us is Andrii, Pashynnyi, Head of the Immunization Department of the Public Health Center. Joining us online is Vusala Allahverdiyeva, expert on disease prevention and immunization at WHO, and Fedir Lapii, head of the National Technical Group of Experts on Immunization. Good morning, dear friends. Mr. Ihor, let's start with you. Can you please tell us about the launch of the campaign? Why is it important? Why is it being launched now? Good morning, dear colleagues, dear friends. It's an important event for us today because by the Ministry of Health of Ukraine, the Centers for Immunization keep on evaluating the risks, and the highest risk is the risk of measles now, because it's a kind of disease which is acute. It's being contracted very quickly. If we check 10 unvaccinated people, at least 8 or 9 children will contract the disease if it gets in their environment. The explosion of measles in Ukraine was happening in 2017-2019. It was a massive outbreak that the government was trying to mitigate within a couple of years. In total, more than 115,000 children were contracting that disease from 2017, and it started with a couple thousand of cases in the western regions, and then it spread all across Ukraine, covering wider communities. The war and the restrictions that we had during the coronavirus, they to a certain extent obstacled some of the families to undergo the vaccination against measles. So since the beginning of the year we started verifying the details, and for the time being we have at least 260,000 children that require vaccination, and before they are vaccinated we will be facing the risks of the massive outbreak of measles. So within these summer periods until the 1st of September of this year, before the beginning of the curriculum year, children need to get their vaccination, their protection, and now we have absolutely everything to make this campaign successful. We have a good European vaccine, we have a new refrigeration equipment, and a couple of units of the refrigeration equipment was supplied to the regional and community levels. The teams are ready for such launch. As using this opportunity, I would like to emphasize that measles is dangerous. It's an infectious disease, so please visit the vaccination stations and make your conscious choice. Mr. Ihor, another question. So is it going to be possible to get vaccinated, say, tomorrow, or when is the campaign being launched? So within the last week we have completed the preparation steps. We had the latest training events going on, so starting from tomorrow you can go and get vaccinated. Well, there may be a couple of days of delay before the vaccine reaches the most remote points of the country, but in the majority of regional capitals, in the bigger cities, the vaccine is already available, so please come and get vaccinated. Thank you very much, Mr. Muhammad. The question will be to you. To what extent UNICEF is involved in this process? What is the role of UNICEF? What do you observe here in Ukraine? And what are the programs that are already in place and what are still planned, related to the vaccination against measles? Thank you.
Uh, UNICEF has always been an organization who has been supporting, the rights of the children, to give them the best start in their life, to make sure that they are healthy, they are productive, and they contribute towards the country's, success and economy, and in every respect. Immunization has been an area where the UNICEF has already been supporting. We have started working from providing the state-of-art, the global standard equipment for the storage of vaccine at the national level, at the oblast level, and at the health facility level. We have already, supported working with the government to provide them, and we have already provided about 6 refrigerated trucks for the support, for the transportation of the vaccine from the national to the oblast level, and about 30 vehicles, refrigerated vehicles, which can transport the vaccines from the oblast level to the lower levels, ensuring their safety and the cold chain. At the same time, we are also, working, supporting the government in provision of the vaccine. So in the last year, we have provided around 2 million doses of different vaccines, including the oral polio vaccine, the BCG, the hepatitis B, the tetanus, diphtheria, and this latest supply of 657,000 doses of MMR vaccine is yet another step. At the third level is the building the capacity of the service providers for ensuring, the best use of the equipment that we have provided. The WHO pre-qualified global standard vaccine storage refrigerators, which are replacing the domestic refrigerators. So to build the capacity of the staff who are related to the vaccine and cold chain handling, we have already, conducted one round of training of trainers at the Kyiv level, followed by cascade training at the lower level in the month of June, where we have emphasized on the, on building their capacity in the areas of vaccine and cold chain management. And it was a hand and job and very interactive sort of a training, which has been quite successful. At the same time, for a continuous reminder, we are also already in the final stages of preparation of the, some posters and some other guidelines, which will continue reminding the vaccine handling staff, of the guidelines, SOPs, and, the important steps. So we are trying our level best, working hand in hand with WHO and with Ministry of Health in providing all the basics and ensuring that all the, the different parts of the puzzle are in place, so that every child in Ukraine, regardless of its location, gender, or background, or wherever it is, he has a right to, and he can access to the quality vaccines so as to prevent them from, the infections. And, the vaccination is one of the best, one of the topmost public health interventions, where the return on investment on each dollar spent on immunization is $16, which is the highest in terms of any other investment in the area of the public health. So we are supporting the Ministry of Health. We are working in hand with the partners in ensuring that this goes on very smoothly. Thank you.
Дякую вам дуже, пані.
Thank you very much, Ms. Vusala. Are you hearing us? We would like to get you join our conversation. Ms. Vusala, can you hear us? Yes, I'm here. I'm with you. Ms. Vusala, can you please tell us about the cooperation between WHO and our Ministry of Health? We're supporting the Ministry of Health in all the issues related to the program of immunization and control of the diseases that are being prevented with vaccines. And with the beginning of the war of Russia against Ukraine, we've realized that the biggest risks we're having now are the risks related to outbreaks of diphtheria and measles. For the time being, very important question that we're having is to decrease the scale of the outbreak. We have to vaccinate all the unvaccinated children who are in the country for the time being. Regardless of the war, Ukraine managed to preserve the network of services to cover every community. The mobile teams, stationary vaccination points, all of them keep working in Ukraine for the time being. And they should all be used for vaccination against measles, mumps, and rubella. We continue supporting the vaccination campaigns since July 2022. We also have trainings for different medical workers and employees. Recently, there was a training for coordinators involved in additional immunization measures. We had training in place for regional trainers who will then continue training their subordinates. We provided 59 buses and 16 trucks that are used by the mobile brigades during the mobile sessions for vaccination in different regions. What is needed now is to arrange better coordination between the communities and medical networks to make sure that the services provided by the medical networks are delivered to all the communities within the time frame that we've planned. It should be done this summer before the month of September, so children get back to school vaccinated. Thank you very much, Mr. Andrii. Then we will ask you for more details about the vaccination, whether there will be mobile teams working or there will be vaccination stations. Who are the target audience? Are they only children, or there are groups of population who are supposed or who should better get vaccinated? Yes, good morning everybody. Thank you for attention to this topic. It's a very important thing for our country in general. As Mr. Ihor has mentioned, we verified those individuals. They are the children aged 2 to 17 years. The total number of children who were not vaccinated with either one or two doses is, and such number is 216,000 persons. So we planned 262 doses to be made available to the public. So we plan to deploy the vaccination stations at the medical facilities and in vaccination centers that were deployed during the COVID vaccination campaign, and we will have mobile teams working. We put special emphasis on the mobile teams because they will be used for vaccination in the educational institutions and for vaccination of internally displaced people. As to the internally displaced people, we have data from every region. What is the number of internally displaced people in every region? We plan certain measures in every single region with regard to the internally displaced people. and the Center for Public Health is the coordinator of the vaccination campaign, and we have appointed regional coordinator at the level of every community. As to the vaccination stations, there will be 2,600 vaccination stations plus 318 mobile teams plus 372 vaccination centers for the population. Also, I would like to use this opportunity to thank UNICEF for the vaccine provided. It's a humanitarian aid to our state. It's one of the best vaccines around, and this vaccine is really very well known in the world. It's a safe vaccine, and should there be a case that your doctor does not advise you to get vaccinated, so you should think about changing your doctor. We've also underwent a training about the freezing chain, so we've learned all the parameters for storage and transportation of the vaccine. The WHO, as Ms. Vusala mentioned, was holding a training for medical support and proper handling of the vaccine. So we urge everybody to get vaccinated. It's very important, so thank you. Well, Mr. Andrii, but you've mentioned about 260 planned vaccinations. I mean, those that are planned within this campaign. So what is the period within which we plan to get those people vaccinated? Yes, today we have the official start of the campaign, and it will last all the way until September. So until the beginning of the curriculum year, we plan. Yes, it's very desirable. There is a law of Ukraine on protection of population against the infection diseases, and there are certain requirements as to the curriculum process. Only vaccinated children are admitted, and again, you said that the vaccine can be bought, but this vaccine is in fact free. It's a humanitarian aid. It's not only about the safety of our country, but it's also about the safety of all the European region. So it's one of our Euro integration tasks. So our medical capacities, are they enough to cover our needs? Well, yeah, it's not something incredible. You know, on the peak of anti-COVID vaccination, we had about 300,000 vaccinations, so it was quite real. Yes, we're absolutely ready. There are certain peculiarities like security situation in a number of regions, but our healthcare system is generally ready. Mr. Fedir, what are the recommendations to vaccination? We know that for the time being, for a lot of parents, I hope for a lesser number of parents now, there is a number of questions arising to the vaccination of their kids. So what is something that you can say? Well, the recommendations are easy. I represent all of our community. We are independent. We provide recommendations for the Ministry of Health based on the scientific research. We represent different areas of the healthcare sector. And our opinion, as an opinion of the doctors, is that infectious diseases in Ukraine are a little bit redundant in Ukraine. Measles is excessive, it's redundant in Ukraine. Some infectious diseases that we can prevent using the vaccines, they should follow the Russian battleship. But why are we talking about the summer period? Because usually September is a time when children get back to schools, they resume their study, and thus create the convenient condition for contraction of different viruses such as measles and other diseases. And on top of that, the COVID-19 has not gone anywhere. The pandemic is still on, and we expect another wave of COVID-19 during autumn. So now it's a very convenient moment for vaccination, so we don't lose these precious days, so that the children are protected against measles as they go to school. According to European statistics, 1 in 1,000 people die of measles. It seems not a huge number, but given certain periodicity, every 5 years, with the coverage that we have in Ukraine, there are outbreaks of this disease in Ukraine. The last one was in 2017, 2019. We had more than 50 deaths, and it's not the complete statistics that reflect the reality. Many children are still unvaccinated, and when we talk about prevention against measles among the adults, we need to create this barrier. It's very important given the conditions of Russian aggression, and we shouldn't give any chance to either measles or any other infectious diseases to weaken us. So recommendation is very simple. Today is Monday. You may visit the vaccination center today, maybe tomorrow. Don't postpone it until the day after, and just get vaccinated according to the calendar of vaccinations. If you have missed it, catch up and vaccinate. So I'm talking about those 262,000 children that were not vaccinated according to their age. Thank you for recommendations. Do we have any information about the combination? If measles is combined with COVID-19, does it make any of those diseases more complicated? Well, I don't have this information. I know that COVID-19 is combined with the flu usually, and I don't want us in Ukraine to verify this combination of measles with COVID-19, but obviously there will be a wave of COVID-19 in autumn. So talking about hospitalization, about 30 to 40% of those who contract measles are subject to hospitalization. That's the same load that we used to have during COVID-19 pandemics. I think that those are still fresh memories for many of us, and we should not put such a load on the medical facilities because we need them for the injured ones. So please don't contract the disease, which can be easily prevented. Well, the question would be to all of you, what could you say to the parents that still are hesitating? I think that the only message in this case is that now is the time when you have to protect your kid. As a father of 2, I can say that my kids are vaccinated against measles because I'm a doctor. I know that measles is a terrible disease that can result in complications not during the infection itself, that may result in pneumonia or otitis or damage to the nervous system, but it may have some remote consequences. For example, after the outbreak of 2017-2019, within years 20 to 23, we were observing the cases of remote consequences of measles, such as panencephalitis, when children have when children contract measles and they have not so severe illness, and the virus disappears from the body, from the organism. But in those situations, when it remains, after 5 years, it begins damaging the brain. And it always ends lethally. We don't have any medicines against these diseases as a complication of measles. It's a slow death of a child, and it's very tragic, and it's something that we still can prevent. We have those whom we cannot vaccinate, who have conditions against vaccinations. And I remember years 2017-2019 when an older child is not vaccinated due to some reason, and they become a source of infection, and the younger children, they contract that disease from them, and they had conditions against vaccination, such as oncological disease, leukosis, but after the transplantation of the spinal liquid, the child died as a result of contraction the measles. So again, it's a question of our responsibility, of our understanding of collective immunity. When some people who have the condition against vaccination, by vaccination of the others around them, we preserve their lives. So it's easy to understand why should we do this, Mr. Andrii. Well, another good example that can be, I think, is to demonstrate how difficult for the adults to experience the measles. And moreover, when, for example, the pregnant women contract the measles, it's a big tragedy. It's a big tragedy not only for one family, and I support Mr. Fedir that demonstrating the vaccination status of your children is the most correct thing. My children are vaccinated too. They keep telling in the school about the vaccines, so this is how they do their job, Mr. Mahmoud.
Thank you very much. There are 2 points which I would like to stress on. Those children who are not vaccinated against measles, mumps and rubella, they are not actually making it difficult for themselves, but they are also contributing to the same risk to the others. Because when a number of the unvaccinated children are collected in one area, then there is more liability, or there is more chances of them getting the infection. So we have right now 2 cohorts or 2 different groups of the children whom we need to, and their parents whom we need to urge to get vaccinated. One are those children, 260,000, which we are talking about, who have already missed their vaccination. They have crossed their age of the right vaccination time, but it is never too late. And second, those who are due. Because if we are able to vaccinate every child in a very timely manner, they will not be able to add up to this big number of the children who are unvaccinated. And as I said, it is not the sickness of one child only. It is the sickness of one family. And unfortunately, if there are more unvaccinated children, it is the sickness of the whole community, with the effects that you can say. And there is no major, contraindication for the vaccination. However, if you have any questions and queries, I urge you to use the facility of the Spill No to Health, the hotline, which is run by UNICEF, and there are the trained doctors who have been trained on this subject of immunization, and they can address to all your concerns and questions, and they can provide you the right guidance. Thank you very much.
Дякую вам дуже, пані Вусала. Якщо ви ще з нами.
Ms. Vusala, if you're still with us, we should ask you about your opinion. What can be your advice for the parents who are still hesitating? Well, the choice is very limited. It's either vaccination or contraction of disease, because vaccination is something controlled by the medical specialists, and the disease is something that is being random. I understand that actually vaccination is the only choice for everybody, but whether you make it or not is the matter of time and a matter of your awareness. I also urge everybody, please address the medical specialist, get the information that you need, make your choice now. Thank you very much, dear colleagues. Do we have questions on the floor? Good morning, Natalia Molchanova, Ukrinform. I have a number regarding the number of measles vaccines. Probably to Mr. Yuri and Mr. Andrii, we have a routine vaccination going on, and the children are being vaccinated according to the calendar of vaccinations. So what is the need in measles vaccines until the end of the year, and did you calculate their needs for the next year? Thank you very much for this question. By the regions, we've spread 334 doses of vaccines, which fully cover 100% of the immunization for such so-called catch-up immunization, and for the regular calendar immunization, we also wait for another shipment of vaccines for routine vaccination, and the need for the year 2024 is already calculated, so there are already funds allocated for this, and most likely the vaccine will be delivered by the UNICEF office as humanitarian aid without the use of the budget funds. Thus, the vaccine which is available for the time being and that is about to arrive should be sufficient by the end of year 2024. Thank you very much. And what about the vaccination of the adults, because they can contract measles from the children? Do we have any vaccination contemplated for the employees of critical infrastructure or those adults who want to get vaccinated? Can they do it using those vaccines that were procured by the government earlier? I will answer this question. For the time being, we're saying that the priority is the protection of children, because children stand in their children's community. They are the bridge for spreading the virus. I'm talking about the school class, I'm talking about kindergartens, and talking about the adults. Vaccination of children is the indirect protection of the adults as well. What we offer to the adults, they can get vaccinated at their own expense. The vaccine is available in Ukraine, or otherwise we have a strategy when there is an outbreak, for example, then there is an urgent vaccination being held. What it means? It means the vaccination against rabies, just like vaccination against rabies. For example, when you have a contact with the source of the infection, but it has not yet developed properly, and in case of measles, it's important to get vaccinated within 72 hours after the contraction. You can also get vaccinated after 72 hours, given the condition that the symptoms have not yet developed, but within the first 72 hours, the efficiency is above 90%. So if we will have the increase of people contracting the disease in autumn, we will implement the protocols of urgent vaccinations. The adults can contact their family doctors, and in case of contact with the infected child, even without any vaccination records, they can undergo such an urgent vaccination. Yet another important question: sometimes there is a demand, or sorry, for example, that there is a report that from a person who was sick with measles in 2017-2019, do they need vaccination? Well, in fact, they do not, but still we use a combined vaccine, just like in all other countries, against measles, mumps, and rubella. And if you're experienced, for example, measles, it still does not protect you against mumps and rubella. So those, for example, who are vaccinated with MMR, they are immune against mumps, measles, and rubella altogether. But those who were sick with measles only, for example, they still require vaccination against rubella and mumps. Thank you very much. I still have another question. It's about the growth of COVID patients during autumn. So can you please tell us what is the situation with COVID-19 for the time being? What is the number of vaccines available? And now that we have the COVID quarantine cancelled, people keep asking how should they get vaccinated in the same way that they get vaccinated against flu. And if we use all the vaccines against COVID, so where are we going to get them from? I mean, for those who want to get vaccinated, well, it's not quite a topic of our briefing, but regarding vaccination in general, now the government of Ukraine receives the COVID vaccine at the expense of International Gavi Fund and at the expense of COVAX Fund. Thus, the vaccine is available in Ukraine. It's as humanitarian aid, and for the year 2023, 2024, it will be available for Ukrainians in the numbers that will be procured by the government. For the time being, we have sufficient number of vaccines for those people who are about to address for it. We have no deficit. We have CoronaVac, Pfizer, we have children vaccines, and there are no problems with supply or demand of some demand for some additional quantities. So before we enter the autumn season, probably it will make sense to make another briefing to import on the vaccination strategy, but generally there is no deficit of the vaccine. Dear friends, do we have any more questions on the floor? Katarina Galko, Espresso, what other infectious diseases that are of threat to us during the war and which can be prevented using the vaccinations, and how? And also, are there going to be vaccination campaigns for other diseases? Thank you. I think that we should talk about two main infections. Is on top of measles is diphtheria and poliomyelitis. There was an outbreak of polio recently in Ukraine. The work of a mission was recently over. We've received good marks. The work was evaluated quite good, but the polio vaccination campaign was not fulfilled to the full extent. So part of the children, they left Ukraine due to the battle operations. Part of the children were internally displaced, so we were not able to cover 100% of this vaccination campaign. So prevention of polio will be a priority within a couple of years to come. Well, until the moment that we have a proper coverage of polio vaccinated children, at least 95%. And another infectious disease is diphtheria. We understand that diphtheria has a high risk of epidemic spreading in organized collectives when children will start going to school, when they start contacting each other in the classrooms. So I'm talking about the kids now. Mostly for the adults, I would like to make an emphasis on the vaccination against tetanus, because we understand that in these conditions of war it will play its role. We have the increase of number of cases, and using this opportunity I want to remind the adults that every 10 years they should be revaccinated, specifically if they are the adults who belong to some risk groups or those who defend our country for the time being. So those three infectious diseases. So I would like to add a little bit. There is a lot of work being done. It may not be so visible, it's not so public, but even as a result of terroristic act in Kakhovka Dam, there was a reaction by the specialists of the Ministry of Health, of the operational headquarters, and we were considering different forecasts, including the most horrific ones. You've heard that we were making some cholera forecasts, but there was a very meticulous work done. The water and ground were sampled. There were different training measures taken. There were different medicines brought in which allowed to prevent the outbreak of those infectious diseases that could be related to the terroristic act in Kakhovka Dam. In the same way, we should say that we are supposed to forecast, we are supposed to predict. It's very logical. I mean, the risks of outbreak of measles in Ukraine, including in our armed forces, and those risks should be currently minimized so we don't repeat the situation of the years 2017-2019. I want to thank our speakers today for a very comprehensive conversation. Dear parents, I want to be confident that each and every of you has heard your argument to make sure that vaccination is a necessity. We live during the period when our children are under threat, unfortunately, so we have to minimize that threat using the means that are available to us. Thank you very much. I want to thank our armed forces, thanks to whom we have this opportunity to hold events like this. Let's work together for our victory, and glory to Ukraine.